If you or someone you love has been waking up at night with painful cramps in your legs, I want you to take this video very seriously. Because for years, doctors and patients alike have dismissed nighttime leg cramps as a normal part of aging, a minor annoyance, something to be solved with a stretch or a glass of tonic water. But the latest medical research is telling us a very different story. Nighttime leg cramps in seniors, especially when they're severe, frequent, or getting worse over time, can be a warning sign that something much more serious is happening in your body. They can be an early signal of heart failure, circulation problems, electrolyte imbalances, medication side effects, or even serious kidney issues. My name is Dr. Ray, and in the next few minutes, I'm going to explain exactly what your leg cramps might really mean, how to tell if they're dangerous, and what to do about them. Please stay with me, because this could be the warning sign that gets you to the doctor in time. Let me begin with a patient story, because I think it perfectly illustrates why we should never ignore this symptom. Her name was Rosemary, 68 years old, a retired nurse, the kind of woman who had spent her whole career taking care of others and rarely thought about her own health. She came to see me because of chronic leg cramps. They would wake her up 3 or 4 nights a week, sometimes so severe that she would scream out loud from the pain, and her husband would jump out of bed to massage her calves. She'd been to her regular doctor, who told her it was probably just low potassium, told her to eat more bananas, and sent her on her way. The cramps continued. She tried magnesium, quinine, tonic water, stretching before bed, hydration. Nothing worked. By the time she came to me, she was exhausted from lack of sleep, depressed from the constant pain, and beginning to dread going to bed. When I looked at her more carefully, I noticed a few things. Her ankles were slightly swollen by the end of the day. She got winded walking up one flight of stairs, something she said was new in the past 6 months. She'd gained about 7 pounds in that same period, but claimed she hadn't changed her eating habits. When I listened to her chest, I heard something concerning, a subtle rattle at the base of her lungs. I ordered a full cardiac workup, and there it was. Rosemary had early-stage congestive heart failure. Her heart was no longer pumping as efficiently as it should, and fluid was starting to back up into her legs and lungs. The leg cramps were not just leg cramps. They were her body signaling that her circulation was in trouble. With proper treatment, including medications, dietary changes, and a weight management plan, Rosemary dramatically improved over the next year. Her leg cramps eventually stopped. She got her energy back, and her heart function partially recovered. Here's what most people don't realize. Your legs are like a window into your overall cardiovascular health. The blood vessels in your legs are the longest in your body. They carry blood all the way down and then have to push it all the way back up against gravity to your heart. When anything is wrong with your heart, your circulation, or your blood chemistry, your legs often tell you about it first. And nighttime is when many of these problems show themselves most clearly, because lying flat changes the distribution of fluid in your body and puts different stresses on your cardiovascular system. So let me walk you through the various things that leg cramps might actually be signaling, starting with the most serious. The first is heart failure, which is what Rosemary had. In heart failure, your heart can't pump blood effectively, so fluid starts to back up in your body. It often shows up first as swelling in the feet and ankles that gets worse by the end of the day. At night, when you lie down, that fluid redistributes, and your legs can develop cramps from the pressure on the muscles and the altered circulation. Other signs of heart failure to watch for include shortness of breath, especially when lying flat or exerting yourself, unexplained weight gain of more than 2 or 3 pounds in a week, fatigue that wasn't there before, a chronic cough, especially at night, and reduced exercise tolerance. The second serious cause is peripheral arterial disease, which is narrowing of the arteries in the legs due to plaque buildup. This reduces blood flow to the leg muscles, and when those muscles don't get enough oxygen, they cramp, particularly at night when blood flow naturally decreases. Other signs of peripheral arterial disease include leg pain when walking that goes away with rest, cold feet, pale or bluish skin on the legs, slow healing wounds on the feet or legs, and loss of hair on the toes and legs. Peripheral arterial disease is a strong predictor of heart attack and stroke because the same process clogging your leg arteries is usually clogging your heart and brain arteries as well. The third cause is deep vein thrombosis, which is a blood clot in a deep vein, usually in the leg. This is a medical emergency because the clot can travel to the lungs and cause a pulmonary embolism, which can be fatal. Signs of deep vein thrombosis include severe leg cramping, especially in one leg, swelling in one leg, warmth or redness in the affected leg, and pain that worsens when you walk or stand. If you have these symptoms, especially on just one side, go to the emergency room immediately. The fourth cause is kidney disease. When your kidneys aren't functioning properly, they can't regulate your electrolytes effectively. This can lead to severe imbalances in potassium, magnesium, calcium, and sodium, all of which can cause muscle cramping. Other signs of kidney trouble include swelling, fatigue, changes in urination, nausea, and loss of appetite. Kidney disease is often silent in its early stages and is most reliably detected through blood tests. The fifth cause is diabetes-related nerve damage. Diabetic neuropathy can cause cramping, burning, tingling, and numbness in the legs and feet, often worse at night. If you have diabetes, especially if it's not well controlled, and you're experiencing leg cramps, this needs attention from your doctor. The sixth cause is electrolyte imbalances, which can happen for many reasons including diuretic medications, dehydration, sweating, and dietary deficiencies. Low potassium, magnesium, calcium, and sodium can all cause muscle cramping. This is treatable, but needs proper diagnosis. The seventh cause is medication side effects. Several common medications can cause leg cramps as a side effect. Statins for cholesterol, diuretics for blood pressure, beta blockers for heart conditions, certain asthma medications, some Parkinson's disease medications, and even birth control pills in younger people. If you've noticed leg cramps after starting a new medication, that's worth discussing with your doctor. The eighth cause is restless leg syndrome and related conditions. While not technically cramps, these conditions can be mistaken for cramps and cause similar nighttime distress. They often involve an urge to move the legs, uncomfortable sensations, and worsening symptoms at rest. And the ninth cause is simple but common, which is dehydration combined with overuse or underuse of leg muscles during the day. This is what most doctors assume is causing all leg cramps, but it's actually only a small fraction of cases. So how do you tell whether your leg cramps are just a minor annoyance or a warning sign of something serious? Here are the red flags to watch for. Red flag 1, the cramps are severe enough to wake you up from sleep regularly, especially if they're getting worse over time. Red flag 2, the cramps are accompanied by swelling in your feet or ankles that doesn't go away overnight. Red flag 3, the cramps are associated with shortness of breath, especially when lying flat or with exertion. Red flag 4, you've been gaining weight without explanation. Red flag 5, only one leg is affected, especially if it's swollen, warm, or red. Red flag 6, you have numbness, tingling, or burning along with the cramps. Red flag 7, the cramps are associated with leg pain when you walk. That gets better when you rest. Red flag 8, you have known risk factors like diabetes, high blood pressure, high cholesterol, smoking history, or family history of heart disease. If you have any of these red flags, you need a proper medical workup. At minimum, your doctor should check blood pressure and heart rate, examine your heart and lungs, examine your legs for pulses, swelling, and signs of circulatory problems, and order blood tests to check your electrolytes, kidney function, thyroid function, and complete blood count. If there's any suspicion of heart problems, an echocardiogram or other cardiac imaging may be needed. If there's suspicion of circulation problems in the legs, an ankle brachial index test can quickly assess your arterial flow. And if there's any suspicion of a blood clot, an ultrasound can detect it. Now, while you're waiting to see your doctor, or if your cramps turn out to be benign, here are some strategies that can help reduce nighttime leg cramps. Number 1, proper hydration throughout the day, following the principles I discussed in my video about water habits. Dehydration alone can cause cramps, so aim for adequate water intake spread through the day. Number 2, magnesium. Most seniors are deficient in magnesium, and this mineral is critical for muscle function. You can get it from leafy greens, nuts, seeds, and dark chocolate. Or you can supplement with magnesium glycinate or magnesium citrate. Talk to your doctor about appropriate doses. Number 3, potassium-rich foods like avocados, sweet potatoes, tomatoes, and beans. Bananas are commonly recommended but contain a lot of sugar, as I discussed previously, so use them in moderation. Number 4, gentle calf stretching before bed. Standing on a step with your heels hanging off and slowly lowering your heels can stretch the calf muscles. Hold each stretch for 30 seconds. Number 5, warm baths or warm compresses on your legs before bed to relax the muscles. Number 6, staying physically active during the day. Paradoxically, both too little and too much activity can cause cramps. Moderate, consistent walking is ideal. Number 7, wearing well-fitting shoes with good support during the day. Poor foot support contributes to leg fatigue and cramping. Number 8, sleeping with loose bedding so your feet can move freely, and sleeping with your feet slightly elevated if you have any circulation issues. Now I want to address quinine specifically because many seniors have been told to drink tonic water for leg cramps. Tonic water contains small amounts of quinine, which used to be prescribed for leg cramps. However, the FDA has specifically warned against using quinine for leg cramps because it can cause serious side effects, including bleeding problems and heart rhythm issues. Don't rely on quinine or tonic water. There are safer approaches. And let me also address vitamin B12 deficiency, which is common in seniors and can contribute to leg cramps, nerve pain, and weakness. If you're vegetarian, vegan, on certain medications like metformin or PPIs or over 70, you may need B12 supplementation. A simple blood test can determine your levels. I cannot stress this enough. Do not dismiss your nighttime leg cramps as normal. Yes, occasional leg cramps are common, but frequent, severe, or worsening cramps, especially combined with any of the red flags I mentioned, deserve a thorough medical evaluation. Your body is trying to tell you something. Listen to it. Rosemarie, the patient I mentioned at the start of this video, often tells people her story at community health talks. She says something that I think is profound. She says, "I spent my whole career telling patients to listen to their bodies, and I ignored my own for too long. Don't make my mistake. When something isn't right, go find out why." She's still with us today because we caught her heart failure early, and her leg cramps were the clue that led us there. If this video has been helpful, please share it with someone you love. Leg cramps are so commonly dismissed, and yet they can be such important warning signs. This information could save a life. Subscribe to this channel for more real, practical health information that most doctors don't have time to give you. And comment below if you've experienced nighttime leg cramps and what finally helped you. Before I go, my standard disclaimer: I am not your personal physician. The information in this video is educational. Please see your own doctor for proper diagnosis and treatment of any symptoms, especially if you have red flags suggesting a serious underlying condition. Do not try to diagnose yourself based on this video alone. Get the proper tests, get the proper care, take care of yourself, pay attention to what your body is telling you, and I'll see you in the next video. Before I sign off completely, let me leave you with a few final encouraging thoughts. Aging does not have to mean accepting every ache and pain as inevitable. Your body was designed to function well, and when symptoms appear, they're usually telling you something important. The sooner you investigate, the easier it is to address. Many seniors in my practice have gotten back decades of quality life because they took a symptom seriously instead of dismissing it. Be one of those people. Take your symptoms seriously. Advocate for yourself with your doctors. Get the tests you need, and know that there is almost always something that can be done if you catch the problem early. Let me also add some practical things about nighttime leg cramps that weren't obvious in the main part of my talk. First, keep a cramp journal for a few weeks. Write down when cramps happen, how severe they are, what you ate that day, how much you drank, how much you exercised, and any medications you took. Patterns often emerge that help identify the cause. Maybe you notice cramps always happen on days you drank coffee late in the afternoon, or after days when you were on your feet a lot, or after days when you forgot your magnesium. This data is incredibly valuable to your doctor. Second, consider your electrolyte balance more broadly. In America, we eat a lot of sodium and not much potassium, which is exactly the opposite of what our bodies evolved for. Potassium-rich foods like leafy greens, avocados, sweet potatoes, tomatoes, and beans help balance out sodium and can reduce cramping. Many of my patients find that simply adding more of these foods to their daily diet makes a meaningful difference. Third, if you take diuretics for high blood pressure or heart conditions, talk to your doctor about whether you need potassium or magnesium supplementation. Diuretics flush these important minerals out of your body, and deficiency is extremely common. A simple blood test can show whether you're low. Fourth, evaluate your sleep environment. Are your feet properly supported at night? Are you sleeping with heavy blankets that constrict your feet and keep them in a pointed position? Pointing your feet for hours can trigger calf cramps. Try a lighter blanket or a sheet that doesn't pull your toes down. Fifth, look at your footwear during the day. Wearing shoes that are too flat, too narrow, or provide too little support can cause your legs to fatigue during the day, leading to cramping at night. If you're on your feet a lot, invest in quality supportive shoes. Your whole body will benefit, not just your legs. And sixth, don't underestimate stress. Chronic stress causes muscle tension, shallow breathing, and poor sleep, all of which can contribute to leg cramps. Techniques like prayer, meditation, gentle yoga, or just deep breathing exercises before bed can help relax your whole body. All right, now I really am going to let you go. Remember, your body is a beautiful, intelligent machine that's trying to communicate with you. When something hurts, especially consistently, it's worth investigating. Don't tough it out. Don't ignore it. Don't let anyone tell you it's just aging. Take action, get answers, and take care of the body that has carried you this far in life. One final thought. Many of my senior patients feel embarrassed bringing up what they think are small complaints like leg cramps. They don't want to bother their doctor with something minor. But I want you to hear me clearly. Nothing about your body is too minor to mention. You are not being a nuisance. You are being a responsible steward of your own health. A good doctor will always welcome your concerns. And if your doctor makes you feel dismissed or unheard, find another doctor. You deserve someone who takes your symptoms seriously and partners with you to figure out what's going on. Your life is worth the extra effort it takes to find the right care. See you next time, friends.